Hey guys, welcome to the Good Podcast. I am your host, Rob Watson, and I've got a really great guest lined up for you today. Her name is Dr. Sarah Davies, and she's a functional medicine practitioner. And I've been holding off on actually posting this one for a while, and it feels like this is a perfect time with it being the start of a new year. So on that, we made it into 2020, folks. Gonna all give ourselves a pat on the back. Often I can, between Christmas and New Year, I can do a little bit of reflecting back on the year gone by, some of the highlights, lowlights, taking everything into consideration. But this one was interesting because you kind of go back 10 years and it can be amazing to think how far we can come in 10 years. I think we often overestimate what we can do in a year, but seriously underestimate what we can do in, say, 5 or 10 years. And often when we have goals and intentions for ourselves, we can almost want them to sort of like manifest really soon, whether it be like, a transformation in our health or our career or our relationships, and we kind of want it to happen now. But sometimes things can take years and even a decade or so to really transform. So I've been doing a lot of reflecting on that to see how much my life has changed and the person that I am now. And I'm really grateful for the changes and the shifts that I've made in my own life. And I'm sure all you guys could reflect on many great things that have happened to you in the past 10 years. And even if you're not particularly feeling that great now in yourself, I think there's always an opportunity for us to be grateful for the changes we've made, for the things that are in our life right now. I know that January can tend to be a bit of a challenging month for people with, Christmas is gone and maybe they've overindulged at times and back to work and the weather's not particularly great and, all that. But I think it's a great time for some, setting some intentions and seeing if we can see them through, to set ourselves some goals. And it doesn't have to be grand things, does it? It can just be something small or anything. But anyway, that's my little thing about the new year. And on to today's episode, which is with, as I said, Dr. Sarah Davies. She's a functional medicine practitioner. She practices in Cheshire, in the north of England, and she's been doing it now for quite a number of years. She's also a trained GP and has worked as an NHS doctor for 14 years or more. And she really transitioned into functional medicine because she wanted to maybe be able to get to the root cause of some of her patients' symptoms. Anyway, I won't go on too much because Sarah says all this way better than myself, but she's seeing some amazing results in people who are maybe got Alzheimer's, who've got autoimmune conditions, people with diabetes, people with toxicity issues, and really helping to transform people's health, and also in a very empowering way. It's showing that we can get well, we can get better from health issues and health challenges that we had. We don't have to just take the general view on stuff that we have to take a pill for the rest of our lives. We can actually take the control of our own health. So anyway, I'll leave it up to Sarah to talk a lot more about this. So anyway, let's get into today's episode.
Same times, it's great to be doing something that you're really making a difference and you can really see an effect for people.
Couldn't go back to normal medicine after this. Yeah, no. This is the best job I've ever done, so I need to make it work. Yeah.
That's amazing to hear. I think more people that can be doing stuff like that they're really passionate about and they feel like they're being of service and making a difference. And also they're getting huge benefits out. You must get for yourself,
Yeah.
You'll be able to improve your health and well-being along the way.
And my family's. So I have started off by really looking after my family. So, it helps everybody. They've been my guinea pigs, yeah.
So for those who may not be aware of functional medicine, could you just maybe give a little bit of an overview of what it's about and how you got into it?
So, functional medicine is really about trying to understand why people get sick, why they become unwell. Rather than what we learn in traditional Western medicine, when I go to med school, you learn basically how to take a patient history, how to do some tests, and you arrive at a diagnosis for that patient. And typically that diagnosis is then going to be paired with some medication that the patient goes away to treat the illness, and that'll be the end of the story. But in functional medicine, we try and have a look at why the patient developed that problem in the first place. And that means that we can actually try and get to the root cause. And what's really interesting is that if you understand why something happens, you can often go back a little deeper and change things at a more fundamental level, which means that you can sometimes get rid of diseases without any medication. And sometimes, instead of just masking the symptoms, they actually disappear altogether. The reason I got into it is I'd always really been interested in dealing with patients with difficult symptoms. I think I used to collect all the women that people couldn't get better. When the first job I had, people who had chronic fatigue or who had funny symptoms that no one could treat all started to migrate towards my office, and I started running late in my surgeries. But I was really, really interested in the fact that some of these people would be able to make themselves well using dietary changes or lifestyle changes, and that wasn't something that I'd been taught about in med school at all. But it seemed really obvious to me that people could make themselves well. And these were people that typically were fairly untreatable. So chronic fatigue, for instance, we have a really, really limited set of resources to help these people NHS-wise. They tend to get some graded exercise therapy maybe, some cognitive behavioural therapy and some support. But there's not a lot often that can be done to help them. And when I came across a few people who'd actually managed to go from very sick to fully functioning again, just through changing diet, what kind of got me wondering was, why aren't we doing this with everybody? Even if a tiny percentage of patients with, say, chronic fatigue get better with changing their diet, we should still be doing it for everybody because there's no risk in it. It's really safe and it might work, and otherwise we've got no treatments. And I started noticing that patients would do the same thing with arthritis. Saw quite a few patients actually in NHS practice that would come in on a special liver diet. And although as doctors we're sort of trained to maybe dismiss a lot of patient stories like this, it always really intrigued me, and I could see that there was something genuinely going on. Right from sort of 10, 15 years ago, I'd started seeing these patients and being interested. I wasn't really sure why nobody else was interested, but it interested me, and just doing research online, reading books, and eventually I had a colleague, Lee Willoughby, who's now in New Zealand, and she and I were really good friends, and we were both interested in nutrition and the effects that you could have through changing diet and lifestyle on health. And we found a course run by Institute for Functional Medicine in London back in 2015, and that's when I really got into functional medicine and started training.
So you've been a GP in the NHS for, 14 years, 15 years?
Yeah, 14, 15 years now, yeah.
Wow.
I still do 1 day a week, so I work in the surgery that I base my private clinic in, downstairs, and I see 30 to 34 patients a day, and then 3 days a week I have my private clinic upstairs, and I'll see 4 patients a day, maybe speak to a couple more on the phone. So there's a big difference between what I can offer when I'm working in my private clinic compared to what I can offer downstairs where I have 10-minute appointments. But because over the years my mindset about how best to treat people has changed, I actually practice functional medicine most of the time now. I don't do a lot of the pill for every ill. Obviously, if somebody walks in with a chest infection, they'll have antibiotics. But if people come in with chronic pain problems or children with glue ear or tummy problems, I'll always give the parents that option of, would you be interested in trying to see if we can work out why your child is unwell, what's making them allergic to things. And most patients I find are really receptive and really happy that I've taken the time to offer the options. And I've just got really long lists of success stories from just being able to offer little simple interventions in that 10-minute time frame. Sometimes it's not 10 minutes and I do tend to overrun still, but yeah, so I'm going to carry on with my NHS work for a bit longer, and and see how it goes. Maybe if my clinic starts to get a bit bigger, I will have to give it up at some point.
So that's great that you're still able to make a difference, in them 30 patients a day. That's that's more than what you'd see the rest of the week in your own private practice.
Yeah.
So, but it's great that you're still able to do that. And maybe I can see the benefits of keeping a foot in there as well to seeing them type of patients, because it might be different to the people that you might see. Is there much difference, or is there a lot of crossover with people?
There's a lot of crossover in general, but I think by the time patients have committed to come to the clinic and sort of embark on a big treatment program with me, they tend to be at the much sicker end and more complex end of the spectrum, which is a shame, because it would be really nice to work with more simple patients in the private clinic, because they tend to do really well really quickly, and very simple interventions can get them better. On the other hand, I really enjoy working with the complex patients, because I'm kind of geeky about trying to work out what makes people tick and why they've got sick. And there's a massive satisfaction being able to help people when they've not been able to find anything else that's worked for them as well. What I have thought about is trying to offer something that's a little bit more low-key and a bit cheaper for patients who aren't really ill, to come and just do health optimisation work with the clinic. So we're thinking about setting up some group visits, so that we can just talk about diet and lifestyle in relation to, say, autoimmune disease, and then also thinking about being able to offer patients the opportunity to work with me with a life coach. So rather than seeing me all the time, I'll work with a life coach, and I'll give them a set of a treatment protocol maybe that I'm hoping will work for them, and then they get to work through that with somebody else.
That sounds like it'd be really useful. So obviously you're still practicing as a GP. Are you finding over the years you've had much sort of like pullback or friction from, say, other doctors who aren't necessarily have been sort of as intuitive, as empowering as you have in terms of all the research you've done over the years, and then finding a different route? Because from my understanding there's very little training in terms of nutrition when you're training to be a GP. Is that still the case, or is it changing?
I mean, it's a long time since I went to university now, but my understanding is that there's still not very much in the way of diet, lifestyle, nutrition training given to doctors when they're training. They have a lot to cover, and a lot of that curriculum is about learning how the body works, and then we also dedicate a lot of time to learning how drugs work and how to give them to patients safely. And so I think it would be really nice to see GPs being taught about diet and lifestyle medicine early on, because I think the guys who haven't had that introduction, that there is a tendency to kind of dismiss it out of hand as in it's not going to work, because everybody knows that if you tell people to eat healthily and exercise more, they don't go away and get necessarily fitter, and they don't do anything you say necessarily. But when we're talking about interventions from a functional medicine perspective, the interventions are really quite specific and targeted at helping the immune system, reducing inflammation, and actually finding out what works for that patient. And so, is there friction? Yeah, there's friction sometimes. I think that my colleagues downstairs understand that I'm a good doctor and appreciate what I do, and tend to overload my clinic sometimes by sending me all the complicated patients that they're not quite sure what to do with. So, I mean, they trust me to look after these patients, and that's good. But especially when it comes to things like looking after women who need T3 thyroid medication, when I then send them back to the GPs, because it's a treatment that's not really available on the NHS at the moment, that can create friction, because GPs don't like to feel that there's a private outlet out there which is doing a better job than the NHS can do. And it isn't good to feel challenged either as a doctor if you don't understand why I might be doing something. So my patients go back to their GPs and may say they're taking 5 or 6 different supplements, and their GP of course has got no real knowledge of those supplements, and some of them will be quite dismissive, and occasionally I'll hear good reports from secondary care from my patients. Not always, unfortunately, but I think we're really at the start of a journey of letting this kind of medicine become a bit more mainstream. It's in the media now, people are much more aware, and eventually that will filter through into medicine. I'm just not sure how long it will take.
Yeah, it feels like there's a paradigm shift going on, and it has been going on for a while, and we're starting to see it. From my own understanding of research, like America's really sort of been like leading the way, and it seems to be like Europe takes about 5 years for it to sort of like catch up in some ways. So yeah, it's exciting. I think it ties into people maybe wanting to feel more empowered in themselves and feel like they can find a way to heal themselves and feel better, rather than maybe sometimes feeling like, oh well, it's just hereditary, there's not much we can do. It's, you know.
That's an amazing part of functional medicine, is that actually as a doctor I don't do much for these patients. I give them education and then they go away and heal themselves, because you do need to be quite motivated to make the diet and lifestyle changes that we recommend, which is why sometimes I think perhaps working with a life coach would work well, someone to hold your hand. But in terms of America leading the way in showing that it can work, yeah, I think that's really true. And there's some amazing trials going on in the Cleveland Clinic at the moment.
Is that Mark Hyman?
Yeah, with alongside the Institute for Functional Medicine. And what's amazing that is what's driving it forward is the insurance companies, who are realising that if you do these trials, not only is functional medicine safe and effective, but it's also a lot cheaper than the drug-based alternatives. And so the insurers are really happy to pay for a functional medicine approach. And I think the Cleveland Clinic now has got a 2-year waiting list for people waiting to be treated via a functional medicine paradigm rather than the traditional Western medical paradigm. So yeah, there's a lot more awareness now. It is starting to take off. And what's really lovely to see is if you go to conferences, just loads and loads of young doctors really interested, really want to use this way of working with their patients. And I know that the lifestyle medicine, particularly, their conferences are really well attended, and that's really heartening to see too.
Yeah, it does sound amazing. How many practicing functional medicine practitioners are there, approximately, in the UK? Has it really grown the past few years?
So yeah, when I started off back in 2015, so I opened my clinic January 16, I think you went on the IFM website for people who were taking on patients, and there must have been 5 or 6 people. Now there's well over a sort of 100, 150, I think. They're not all doctors. And then some people have fully finished all their modules and their exams, and some people are at various stages of working through the training. I finished my training now, and I'm waiting for my exam results in the next week or so. So hopefully I'll be certified soon. I think it's definitely growing, not only amongst the medical profession, but also there's lots and lots of therapists out there, so nutritionists, chiropractors who are wanting to use these techniques with their patients.
One thing you just touched on then about how the change in America with the way the insurance companies are now getting behind it and seeing that it's actually going to be beneficial, and it feels the same. Obviously we have a different model here with the NHS, but the budget's well over 100 billion a year, isn't it, to run it? Surely, and I'd imagine a massive amount of that goes on chronic illnesses. I don't know what the makeup would be, but if there was a shift in it and there was more of functional medicine applied within the NHS, well, it's going to potentially save billions.
I mean, the really good example at the moment is the work of the lifestyle medicine doctors at the moment driving forward the low carb diet for type 2 diabetes. So, Dr. David Unwin, who's based in Southport, has shown that he can basically hand a good proportion of his drug budget back at the end of the year by, instead of prescribing anti-diabetic drugs to his patients, he actually de-prescribes them, puts them on low carb diets. These guys lose weight, they get healthy, they can come off their drugs, and we're now seeing that it's definitely possible, even in an NHS setting, to reverse type 2 diabetes. Now, diabetes globally at the moment is being driven by our food environment. So we have a refined carbohydrate environment, which is basically diabetogenic and drives high blood sugars in more and more of the population. We're becoming more sedentary and more obese. And so actually, if these changes were adopted across the NHS, that could definitely save millions and millions in prescribing just for diabetes alone, let alone the benefits of the weight loss in terms of things like heart disease risk and dementia risk and blood pressure. So at the moment there are still, I think, political blocks to implementing low carb diets with diabetics, which to me just seems ridiculous. But there's still a big drive, unfortunately, to promote the old-fashioned way of thinking that we should perhaps be looking at low-fat diets, which there is really good evidence that changing towards low carb is much more beneficial.
And that's low carb, high fat approach.
So yeah, low carb, high fat, but high in terms of healthy fats. So it's really avoiding the trans fats that we see in processed foods, because they're just going to cause us heart disease to be driven further. But if we're looking at unprocessed healthy fats, actually there's no evidence that drives heart disease. And I think there's still a lot of confusion both amongst the medical profession and the public, thinking that if you eat fat, it's going to basically fur up your arteries and give you a heart attack. That's definitely not seen to be the case at all. And in fact, the Mediterranean diet, where we encourage nuts and avocados and olive oil and oily fish, shows us that healthy fats are actually reduce the risk of cardiac disease.
So in terms of trans fats, we're talking like vegetable oils?
So we're talking about vegetable oils, especially if you've heated them. So if you're going to bake with vegetable oil, fry in vegetable oil, so sunflower oil, rapeseed oil, then the fats become oxidised, and so that's when they become quite reactive and cause damage to the cell membranes and the lining of the blood vessels. If you do want to eat natural seed oils and nut oils, or sunflower oil even, you can do that in small quantities, but really that should be cold pressed and drizzled on as dressings or added after the cooking process. So if you're going to heat fats, you want to think about heat stable things such as coconut oil, olive oil, or you can use avocado oil if you can afford to cook in it.
Yeah, we've got avocado oil, but we use it sparingly when we're cooking.
Sparingly in cooking, yeah.
Because I'm aware that seems to be more tolerant to heat than even olive oil as such.
Very, very heat stable avocado oil, yeah. In theory, you could fill your deep fat fryer with it.
Wow. There you go, listeners. Get back on the fried chips.
Mm-hmm.
Do you know what are being tested? Well, not fried chips. I'd love to hear then, patients that come to you, what do they tend to be like, the conditions or symptoms that you're generally sort of experiencing?
So most of my patients have got either a fatiguing illness that hasn't necessarily been diagnosed, or have got some form of autoimmune disease. I'm now starting to also see people with cognitive decline and dementia as well. So there's a fair mix. What I would say, so chronic fatigue syndrome, within people who've been given a diagnosis of chronic fatigue or who just feel tired all the time, there's a big spread in terms of what the actual underlying cause is. So I see a lot of people, especially women, with thyroid disease that maybe hasn't been fully treated or has been undertreated or not diagnosed. I see, worryingly, an increasing number of younger people even with undiagnosed B12 deficiency, with fatigue and neurological symptoms. And it's amazing how, unfortunately, the diagnosis of B12 deficiency can get missed. I mean, it's great for me because I can make them feel well within a few weeks. But I think that's, so when we talk about nutrition not being taught to doctors, I think there's a real tendency for doctors to dismiss B12 as just being another vitamin, and really not to realise the consequences of not recognising and treating the disease. and also a lack of recognition of the fact that the reference ranges and the tests used in the NHS are really not quite fit for purpose for everybody. I have quite a lot of people with B12 metabolism disorders who have normal NHS B12 readings, but perhaps very low intracellular B12. And unfortunately, they don't get picked up, and they can get quite advanced disease before maybe they come and see me and it gets recognised. I would like more GPs to be able to recognise B12, because I shouldn't be seeing those patients. They should be dealt with outside a specialist clinic. Autoimmune disease, see a lot of arthritis. B12 deficiency in itself is an autoimmune disease. Lots of thyroid disease driven by autoimmunity, lupus, and then increasingly more patients with MS and neurological conditions. More recently, I've been working with Dr. Dale Bredeson's protocol to reverse cognitive decline in Alzheimer's disease. I'm starting to see some good results just from a couple of months of treatment of people with cognitive impairment, and that's been a real eye-opener to me. And I'm sure it's an eye-opener to most of the population to realise that actually a disease like Alzheimer's can actually be treated with functional medicine techniques, and you can actually see reversal of cognitive decline. I sometimes see children as well. They're really rewarding to work with. They're children with allergies and sort of what's generally labelled functional bowel problems or skin problems, because they usually respond really beautifully just to diet therapy alone and very little else. The NHS is really hung up on whether you've got an IgE allergy to something. So, and as long as you're not going to have anaphylaxis that's going to kill you, then there seems to be a sort of real lack of interest in this layer of people who have serious conditions and discomfort, just driven by food sensitivity or food intolerance, that if you go about looking for them in the right way, you can identify and then alleviate the whole problem rather than just trying to mask it with medication.
That's amazing to hear all the results that you would get, particularly like with dementia, because I think that can be the case with even with sort of like going back even with cancer. People think it's a bit of a death sentence and it's just going to go one way, but to know that through functional medicine and other approaches around the world that you can do something about it, it's really empowering to realising that and heartwarming to know that if you're working with the right people and you've got the right support, because I think that's really key as well, having the right support, someone that you can trust who can guide you along the way. Because if you just go online and search for stuff, there's so many different things. So yeah, it's good to know that you're around here and there's hundreds more of you popping up around the country to help people.
Yeah, it's amazing the uptake of the functional medicine courses now with young doctors. There's hundreds of them training every year now, which is amazing. Wow. So yeah, there's soon going to be lots more functional medicine doctors in the UK. With regards to dealing with complex treatment protocols, like Dr. Bredeson's RECODE protocol to reverse Alzheimer's, yeah, it's much easier to work with a practitioner than try and do it on your own. He's an amazing guy. I went to hear him speak about a month ago to a really packed audience, and he's just an amazing guy who's done all of this research against. In terms of, even though he couldn't get funding to do research because everybody just wants to test one drug against dementia, and he said, well, I want to employ multiple techniques to get small gains in multiple areas to try and treat people. And he spent so long just trying to get people to fund that kind of research, but now it's really bearing fruit, and I think there's over 3,000 patients that he's aware of been through his protocol. Wow. And he's getting good results in really significant percentages of those patients too.
Wow. Now, I'm aware that you very much look at the science side of things as well, so you do some really offer some thorough lab tests and stuff, so when someone comes to see you, you've got a big picture of what's going on. What kind of things would you do with a patient?
So the first thing that we do is we take a really full history from birth or pre-birth through to the present day, so that we get a really nice idea of what might be the triggers from the person's life, whether that be genetics, so have they got a family history, is there some trauma that they've had in their life, are there any clues from infancy of something that's happened to them, or of allergies early in life that have looked like they've disappeared. So that history is the most important thing. And then the next thing that we offer is some of the more advanced testing that perhaps isn't available on the NHS. So when we look at thyroid disease, for instance, instead of just looking at a TSH or maybe a TSH and T4, we'll also look at the active forms of the thyroid hormones. We look at T3, go and look for antibodies. Has this person got antibodies against their thyroid gland that perhaps haven't yet materialised as hypothyroidism fully? And we'll sometimes look at what's called reverse T3, which, especially in my chronic fatigue patients, can be high with normal levels of thyroid hormone. And because reverse T3 can mask the thyroid hormone effects, people will clinically feel hypothyroid. So advanced thyroid panels will do a very full nutritional screen. So we do serum, B vitamins and vitamin D, which is often overlooked in the NHS. One of the problems with nutritional screening NHS-wise is the funding or lack of funding for it. So where I work at the moment, I can't get a vitamin D level without having a very in-depth chat with the laboratory manager about why it is I need it, because it's deemed as a non-essential test. As well as normal blood tests, we offer organic acid screening and amino acid screening. So I use Genova Labs predominantly for my big panels. And that's amazing because you can really look at what's going on inside the cell. So you can see all the B vitamins, how well they're being absorbed and utilised within the cell. You can start looking for bacterial and yeast overgrowth. And you can look at the nutrients that fuel the mitochondria, which make energy, so to see how well the energy systems are working. Look at omega-3, 6 and 9 profiles, and look at nutrients which perhaps are not available at all on the NHS. So we're going to look at coenzyme Q10, we're going to be looking at glutathione, which is essential for as an antioxidant and mobilisation of heavy metal toxins, and we also look at all the mineral elements and maybe homocysteine. So we look a lot at somebody's ability to be able to detox normally, to be able to process and build proteins normally, and to be able to metabolise their own chemicals normally.
So you leave no stone unturned then, in a way?
We try and leave no stone unturned. Obviously it can be an expensive process doing full functional testing, and the metabolism part is just one aspect. We also do offer microbiome testing, so you can do stool analysis to see what kind of bacteria are growing there, whether there's any pathogens, and we also look maybe a bit more in depth at hormones. So the sex hormone pathways and whether those may be out of balance. So we have a lot of tools at our disposal, which is really nice and which I completely appreciate my NHS colleagues don't have. But it does mean that instead of trying to guess what's wrong with somebody and just instigating a general protocol and hoping for the best, you're actually giving them a really targeted treatment plan that's aimed at treating the problems that you can see on paper. And that's what's the real difference that I can see between lifestyle medicine and taking it to the next level and practicing functional medicine, is that it's not just about diet and nutrition. We're actually looking at precision engineered treatment protocols for specific problems that we can identify on testing. And I think that's what really makes the difference, especially when it comes to managing patients with thyroid difficulties that aren't getting better with the normal treatments on the NHS, and managing chronic fatigue. It makes a massive difference.
Yeah, thyroid seems to be a big one. Like, I know so many people in my family who have got, it's either underactive, it's overactive, and like you say, through the NHS you'll only get, the ranges are out as well, and it only goes like, TSH and stuff like that, so it's
So actually, one of the things about me is that I actually have hypothyroidism myself. I've got Hashimoto's hypothyroidism, so I'm not sure when it started. I think I was quite overweight in my teens, which was possibly the beginning of it then. And then when I first found out about doing the elimination diet for arthritis, that's when I basically changed my diet. I think I must have reduced my thyroid antibodies at that point. So they were quiet for a while, but then in the last 18 months I'd started to get more tired and cold, and it was actually my staff that were all looking at me going, Sarah, you really need your thyroid checking. I was like, no, it'll be fine. And eventually the first doctor that walked in the door, they said, you've got to take her blood, and he took my blood for me, and I had really low levels of T3, actually, and very borderline low levels of T4, and I knew that if I went to my own GP about that, they would only be able to give me T4, and from my experience working with lots of patients with my own condition, I wanted to give myself the best chance of getting better quickly, because I've got, a business to run and a job and my 2 small children at home. So I've started T3, and I think if I feel more stable in the future, I might see how well I tolerate T4 in the future. So I'm getting help with my thyroid now, and I feel loads better.
That's good. I've got a friend who actually he's gone down all the natural routes, and then eventually he just been prescribed T3, and he said it was like a switch being flicked, and he was like, wow, this is what it feels like to feel normal and to feel good.
Yeah, to be honest, within about 3 days, it felt as though somebody had kind of poured that sort of energy and kind of enthusiasm back into my veins. And I hadn't realised how tired I was until I felt normal again. But yeah, so my enthusiasm for the work and kind of changing my practice and moving things forward, it just really stemmed from starting T3 actually.
Wow, that's really good. And you touched on arthritis, so did you have arthritis when you were younger?
Yeah, so I started with joint pain and swelling in my wrists when I was about 14, 15. And around my 20s it used to get quite severe, and I'd also get facet joint pain in my back that would go into my ribs and make it difficult and painful to breathe, especially at night. And all I'd ever did was sort of treat it with a bit of ibuprofen and ignore it. And then in my 30s, so after my first child, it got really severe. I would wake up and I would have pain in my feet, my ankles, my knees, my hips. And then taking my baby out of the cot, it was really difficult because it would take about a minute to 2 minutes to be able to open my hands, and my wrists would hurt. So I had a couple of really severe flare-ups, and what actually saved me was that my children had problems because they inherited my allergies. Basically, they've inherited my immunoglobulin G sensitivities. And so, although I never did the elimination diet for me, I did it to help them when I was breastfeeding. And so I did an elimination protocol, the same as I'd share with any of my autoimmune patients now. This was before I was practicing as a functional medicine doctor. And not only did they get better, but also my arthritis completely cleared up within about 2 months. And now I know it's just gluten related. So when I say I have arthritis, I don't have arthritis anymore. If I ate gluten every day, I would have a lot of joint pain. But basically, as far as I'm concerned, I've got gluten sensitivity. I'm not celiac, I've tested myself, but gluten basically gives me multiple joint pains. I also have cross-reactivity with dairy and soy. So my entire household are now gluten, dairy and soy free. So I never put a patient on a diet that I haven't done myself or don't do myself, apart from the keto diet, which I'm working on.
That's amazing to hear that, how you've had them experiences and you've been able to transform them, and in a way it's almost a gift for you, because that gives you the tools to how you can then help others. In a way, I think a lot of people who maybe move into certain places and certain careers, it's because they've got that experience and they've had them challenges themselves that they feel like I can share this now.
Yeah, so I mean, by the time when I was 19, I had another autoimmune disease. I had Guillain-Barré syndrome, and I was paralysed. Fortunately, I mean, this is where acute medicine comes in. I mean, the NHS saved me. I was not far off not being able to breathe. I couldn't use my arms or legs. I was bedbound. And they gave me immunoglobulin therapy, and it went away within a week. And after about 8 weeks, I could walk and do everything again.
Wow.
So I was really lucky to make a full recovery, because not everybody does, from Guillain-Barré syndrome. But I think underlying my multiple autoimmune conditions, so I've got the thyroid, the joints, and then the Guillain-Barré, I think is this food intolerance, the gluten sensitivity. And because I know it worked with me, it really gave me the confidence when I started working in functional medicine, before you've had experience, reversing people's autoimmune conditions, to think, well, it's worked for me, so it's probably going to work for other people too. And indeed, my experience now is that overwhelmingly most autoimmunity can be quite effectively reversed just through diet. It's a real shame that fact is not acknowledged, and in fact is generally sort of thought of as slightly dangerous propaganda as far as most doctors are concerned.
Yeah, it's challenging, isn't it? Like you touched on there, there's so much to admire about the way medicine's developed, in terms of, like, if I'm in a car crash and I need to be put back together, or I suddenly have a heart attack, that is exactly what I need in that moment, and they would keep me alive and put me back together. But it's just like, you say, when it comes down to more stuff to do with, chronic illnesses and whatever they are, then there's not really the right protocols in place, which you do now offer. So I'm interested to hear then because you talk about your own success stories, and now you've been helping hundreds and hundreds of people through your own practice, to hear some of the success stories that you've had with people who are almost at the wit's end. They've done everything they possibly can, or they thought they had done it, and then they've come to you. And so it'd be nice to hear some of them.
So there's quite a few. What's most rewarding to work with, I think, is people with arthritis. They get better really quickly. So I had a young girl came to me in her 30s, and she'd been put on a drug called methotrexate for a very rare form of arthritis that gave her fevers and joint pain. And she'd basically been told that she couldn't really come off it, and they didn't have any other treatment for her. And I worked with her over a period of 6 months, and she was really keen to come off her medication, even though I said, well, look, let's get you well and then consider withdrawing. And over that period of 6 months, all we did really was work with her diet, and we supplemented her nutrition a little bit to help her gut heal, and to help with her normal immune mechanisms so that they worked better. And her arthritis completely vanished, her fevers disappeared. She came off her methotrexate and realised that some of her symptoms were actually due to the drug itself and not the underlying autoimmune condition. And not only was she able to come off the drug, but then she was then also able to start planning a family, because of course a lot of these medications, such as methotrexate, will stop you being able to conceive safely because of the potential damage to a baby with them. So that, within 12 months she had complete resolution. And what was really funny was she went and shared this with her consultant, who just said, oh, it's just a coincidence that she'd got better, despite the condition that she'd been diagnosed with. Basically, I read all the prognosis online, and it said it would typically continue for life. So yes, arthritis can be very rewarding to work with. Chronic fatigue, I have a patient now who has been working with me for about 18 months. And she has been through various stages of being just about functional, and then being bedbound and crashing from time to time. And we did lots of work together on getting her nutrition right, and getting her thyroid right. And then eventually we found out that she had a problem, a rare genetic problem, getting rid of heavy metals. And she started with a special protocol to help reduce the heavy metals in her body. And within about a 6-month period, she went from being practically bedbound to back at university and able to sit her exams. So that was one of the most amazing recent things that I've seen, with such a big marked difference from being bedbound to being back at uni again. There's so many. Which ones to share with you? A guy came to see me about 6 months ago with really severe brain fog and fatigue. He was struggling to work, and he just was about to have a new baby. In fact, I think he came to see me on the day his wife was due, which I thought was crazy. And he actually confided in one of my staff that he'd paid off his mortgage and made arrangements for himself not to be able to work because he actually thought he wouldn't be able to continue. We treated him for bacterial overgrowth of his bowel, because when we did testing we could see he had really high ammonia levels caused by excessive fermentation, and we improved his nutrition and his diet. He's been extremely compliant. He's an amazing guy. And now we're about 6 months later, and he's told me that he's just been rated 3rd in his company. He's back at work, he's doing everything, and he's enjoying time with his kids.
Wow.
So yeah, he's doing really well.
That's amazing to hear them stories. And for you, that must just feel phenomenal to know that you can make such an impact. And it's really transformational for them. Their life is unrecognisable in what they can go on, and that will continue for the rest of their lives, potentially.
Yeah, I just, in the NHS, one of my really standard things to do if somebody comes to me with either fatigue or autoimmune type symptoms or bowel symptoms is just to simply give them a copy of my elimination diet and say, this might help you. And a lovely lady from my clinic downstairs in the NHS, all she did was come and talk to me, 10 minutes, I gave her the diet, and she's come back 5 weeks later saying that her life has been transformed. That was just a 10-minute interaction with her. Her lifelong anxiety has gone, all her digestive symptoms have gone, all of her chronic pain in her joints has gone, and she just feels amazing. So yeah, it's amazing how very small interventions can make huge impact. That can of course go on forever, whereas just another pill and just another prescription is not actually fixing the problem, whereas if you can find the root cause, the person actually gets better.
Yeah. And just touching on in terms of some of the pills that you mentioned, person with arthritis, some of the pills actually with the side effects, sometimes you read into it, because I'm going back when I was in my 20s, I'd go to the doctors and I'd get prescribed stuff and I'd just sort of take it and not realise potentially the side effects, and I know that some of them made me feel worse. And when you actually look into it, it's a small piece of paper, it's all wrapped up, you don't look at it and you think, sometimes I think, how can this actually be prescribed if they're the potential side effects in some instances?
I think one of the reasons why I never went to my doctors with my own arthritis in my 30s was because as a GP I knew about what the rheumatologists could offer me in terms of treatment, and I didn't want to take it. I really would prefer to just kind of carry on with pain and swelling rather than take the medication, because I was fully aware of the potential harms of it. I think for some patients there isn't another option. This therapy sometimes is quite slow to work and they need something in the interim. But yes, the ways of working with arthritis are very, very different. So the NHS therapies are actually geared at suppressing or killing part of the immune system. So you're actually left with a person who's immunocompromised and more likely to get cancers and more likely to get infection. On the other hand, for these patients, you've got to remember these drugs can be transformative from a life of pain to a life of being able to function. So people and rheumatologists of course take those risks. What we offer in functional medicine though is a chance, And it's, to be honest, it's a fairly good chance that you can do that without drugs. And instead of suppressing the immune system, we actually encourage the immune system to stop overreacting and to start working correctly again. So there's no immunocompromise. In fact, you're actually improving someone's ability to kind of patrol for bacteria and viruses, and at the same time perhaps suppressing the reactions which are happening against just normal everyday foods that are perhaps going into their bodies and being misinterpreted as a danger signal by their bodies. The food sensitivity autoimmunity link, especially in arthritis, is huge, and you shouldn't really underestimate how powerful the dietary changes in turning it off. There is definitely a place for disease-modifying therapy that is used in secondary care, and we're very careful not to withdraw patients from it unless we can. Typically advise someone to stay on it for 6 months while they get better, and then to withdraw slowly with help from their rheumatologist. I have patients that don't want to do that and that have taken themselves off it, but they have not been counselled to do so by me. Yes, so functional medicine, if it works, is really good. We also have a few other disease-modifying medications that we can use from a functional medicine standpoint that aren't commonly used in the NHS. So I have got quite a lot of experience now using low-dose naltrexone, which is an opiate receptor blocker, and at the tiny doses we use, it's really safe. There are no real known side effects or problems with it. And that can be amazingly effective at switching off antibodies in people with thyroid disease, especially Graves and Hashimoto's. And we think it's also can be useful treating Lyme disease and some patients with chronic fatigue and MS. So I do quite a bit of work with low-dose naltrexone as a disease-modifying drug when diet or whatever else isn't working, or when we need something to switch off antibodies fast. That can be effective.
Hey guys, this is me just interrupting this episode. No, it's not an advert. It's just to let you know that very shortly there's going to be, I went over to interview Sarah for this podcast, and partway through the episode it started torrential rain outside, and we were in this bit of a loft space, so I think it was hailstone and it was kind of pelting against the roof and the windows, so there is a bit of background noise now which will last about 5 minutes or so, but anyway, there's still some great information here, so please stick with us. Thanks.
So you've obviously, you've got so many people come in different conditions: chronic fatigue, arthritis, thyroid issues, gut issues and stuff like that. Is there any stuff that you would tend to say, offer a certain protocol which you think can work for all of? I know it's not like, but is there some like base level stuff that you'd say,
So, as functional medicine doctors, we do have a bit of a reputation for stopping people eating gluten. That's the big one. And while I wouldn't say nobody should eat gluten, what I would say is if you have a predisposition to autoimmunity, or if you have chronic fatigue, one of the first things to try would be eliminating gluten from your diet. It can cause quite a bit of damage to the gut, so even if you're not responding immunologically to the gluten itself, it can increase intestinal permeability and allow other maybe undigested food particles or bacterial and yeast endotoxins into the bloodstream, which can trigger the immune system to overreact. And so going gluten-free is one of the kind of core messages that our patients will get when they come to the clinic. And that will tend to be across the board, whatever you manage to come to us with. Other than that, we're going to be looking at making your diet as nutritionally complete and nutritionally dense as possible. So reducing sugar and refined carbohydrates, eating a broad spectrum of fruit and vegetables, so trying to eat the rainbow every day, because all of those different colours in the fruits and vegetables have different phytonutrients in that have different roles in the body. And so if you can kind of keep eating a big variety of foods, then you'll get all the little trace elements and different antioxidants that you need. We will also make sure people are trying to hydrate themselves properly. we would encourage people to have a healthy intake of protein, whether that's a vegetarian protein or a meat protein. And we'd advise people to look at the quality of the food that they're eating. So we tend to advise that you should be organic, especially with the more contaminated foods if you can afford it. Because we know that organophosphates and pesticides can build up in children especially, and also in lots of our patients have got problems with their detox systems, so they either have an enzyme or a liver problem that might stop them being able to get rid of things like organophosphates, and they'll tend to sort of persist and build up in their systems. And it doesn't just stop at foods. We also ask people to have a think about the water that they're drinking. We advise filtering it or drinking bottled water. We'd advise looking at your personal products and trying to avoid nasty chemicals that you don't need to be exposed to, like SLS and parabens and benzene. So looking at more natural alternatives that aren't going to be toxic and that aren't going to give you a heavy metal load. So aluminium containing deodorants, we tend to tell people to discontinue and find a more natural alternative.
Plenty of great things in there really for people to potentially action. And you touched on about organic, and I know it can be a bit of a, some people think, well, I just can't afford it. And I know in terms of your meat and your fish, particularly a chicken for instance, can cost like 4 or 5 times more than a non-organic, so it's a bit of a tricky one. Is it the clean 15 and the dirty dozen?
That's right, so the clean 15 and the dirty dozen, they tend to change each year as well, but there are certain foods that are a lot more likely to be pesticide laden. So unfortunately your baby salad leaves, blueberries, celery, anything that's sort of going to be get a dusting to kind of keep nasties like slugs off it, can be quite high in pesticides. Whereas when you've got things like avocados or fruits that you can peel, sometimes they'll be a lot lower, and so they would be safe perhaps to buy as a non-organic. For myself, I tend to get an organic fruit and veg box every week, and I'll buy organic when I'm in the supermarket. But if I'm out and I can't get anything else, if my kids want some blueberries once in a while, then they might have non-organic blueberries, which I know isn't perfect, but at least they're eating something with good nutrient qualities at the same time.
Yeah, and I think it's about to do our best.
Yeah.
Because I know from my own experience, I've ended up getting quite anxious at times thinking, and then that anxiety is actually just making things worse when I should really do. While I'm at home, we've got filtered water, we filter our shower water, we buy organic as best as possible, we have something to purify the air in the house, so we know, and we have all plants everywhere, so we know we're doing our best to create a healthy environment at home. And if we can go out and get organic, which you can't really do that much at restaurants, you can certainly buy in shops, but there's not many. I think there will be more and more over the next few years and stuff will be popping up, but now I'm much more relaxed when I go out and think, you know what, I'm not eating out 3 times a week, I might go out a couple of times a month now, so I'm okay with that.
Yeah, so eating in restaurants, I don't think I would ask anybody to be making sure it's organic. You want to go out and enjoy yourself if you're in a restaurant, because especially for someone like me, I already have food restrictions. So with being gluten, dairy and soy free, I'm already asking restaurants usually to do something a bit different for me, and that's quite nice sometimes because you can ask for a more healthy option. So I can have some meat or some fish with a salad, or vegetables without the butter on. And so often kitchens have to think a little bit when they're preparing food for me and my family, and we can ask for something a bit healthier.
So with them kind of things, do you ever ring up the restaurant beforehand that you might do just to sort of touch base with them, or do you tend to just pull the waitress over when you get in and say, listen, these are the things?
So my children are 5 and 8. Our going out to restaurants tends to be fairly spontaneous. When we've sort of been out for the day and we can't be bothered going home and cooking, we might take the kids out to a restaurant. We tend to be quite selective in which restaurants we choose, so we find ones that we know will cater to us and stick with them. So we like taking our children to Pizza Express because they actually have got a great line in allergen-free foods. So my children never get pizza at home because I'm not going to cook them pizza. But when we're out, then they can have a gluten-free base, and they can have the dairy-free cheese, and it's a real treat for them. So yeah, so some of the big chain restaurants are actually much better at providing an allergen-free menu if you're on a budget. If it's just me and my husband going to eat out, to be honest, if you go to a good quality restaurant, I've not really found a problem asking about allergens on the day. Most of them are now fully aware. They all have allergy menus, or you can speak to the chef and they'll prepare something for you. It's the medium range going into pubs who may not be sort of set up as well for allergies. That can sometimes be an issue, and end up having chips and vegetables or something. It can be terrible, but most of the time we manage it quite well now, and it's something you just get used to doing.
Yeah, I know that you talked about there's like people who come with autoimmune issues, and then there's certain diets that are becoming quite popular over the past few years, so very much like healing the gut, healing the body. So you've got the AIP protocol, healing the gut, and then you've got like the idea of a primal premium approach, which is tapping more into our like ancestral way of eating. And then something that I've become much more aware of and seems much more popular, like the ketogenic diet, and it's some of the results around that seems to be pretty phenomenal. But it does seem to be kind of like us going back to our roots. Seems to be at its core of the way we're going through. You know, the past, I think, is it 12,000 years that we've been doing agriculture, and that tends to be, you know, if you go back before that, we probably would have all maybe had it more of a, or we would have all been more like a paleo primal keto type of diet, eating as nature intended. So definitely seems to be a swerve back for that. What are your thoughts on them type of diets?
So one of our baseline protocols, if you come in to see us with autoimmunity, say, would be to try the autoimmune paleo protocol, which you mentioned, which is basically, for me, it's an oligoantigenic diet, so it's removing all the major allergens from the diet over a 4-week period. But then at the same time, we also remove refined carbohydrates, sugars, grains, legumes. So we're going back to a paleo diet, and we're looking at, as you describe it, a nice ancestral diet. So one that's unlikely to lead to the immune system being activated. And we do that for 4 weeks in most of our patients, and then we would start food reintroductions. The one food that we tend to not encourage people to reintroduce or to challenge is gluten if they've got an autoimmune disease. So yes, we use paleo widely, and then after we've taken someone through the paleo protocol, we're then going to look at what works best for them. So lots of our patients will not only have maybe food intolerances, but might also have some chemical sensitivities. So we often find patients who don't process histamines very well, and sometimes that can take 6 to 9 months to wear off with some help and support of the gut. Sometimes patients have problems with oxalates or salicylates, and they're much more challenging diets to look at. But we work with a specialist nutritionist who can help patients with that. In terms of the keto diet, that's something that we're going to think about if we want to help start repairing the brain. You can also use a keto diet to reverse diabetes rather rapidly too, because it's very, very low in carbohydrates. So keto is high fat, very low carb. So about 60% of your calories a day will come from fat. You can adjust it. Each person will have a slightly different tolerance. And one of the benefits of being in ketosis, that means burning fat rather than burning carbohydrates, is that you get a really nice stable energy level. So whereas our blood sugar levels will go up and down, especially if we've got insulin resistance or metabolic syndrome, so that perhaps our bodies don't recognise insulin well and our blood sugars become unstable. With ketosis, you're basically burning fat 24/7 and you don't run out of energy. So you get a nice stable baseline. The other thing is that our mitochondria which are these little tiny battery packs inside of our cells, they actually run around a third more efficiently in ketosis than they do burning sugar. And so especially for patients with chronic fatigue, what you're going to see is an improved availability of energy. So the same number of calories in, but more energy coming out from the mitochondria. One of the problems with instigating a keto diet is that the first couple of weeks can be really rocky while your body makes the adaptive switch from burning carbohydrates to burning fats, and so people can feel quite unwell and sort of low blood sugary, and especially if you've got chronic fatigue, that's quite an unpleasant process to go through. The other reason we would use it is to heal the brain. So Dr. Bredesen has shown that while in ketosis, this sort of fasting state, the brain will actually go into repair mode, and when he's put patients into ketosis alongside the other measures of his RECODE protocol, you can actually start to see growth in the hippocampus, which is the memory area of the brain, on the CT scan. So I mean, and his research into the effects of ketosis on the brain is really quite profound. And so for all our patients who've got, say, MS, Alzheimer's disease, or perhaps severe bedbound chronic fatigue, we're going to be thinking about, is the keto diet going to be a good thing for them to try? One of the things about being in ketosis is you really need to have quite good thyroid and function to do it. So to burn fat, you do need sufficient T3, the active thyroid hormone. So it's not something that we would instigate straight away. We would always go via a high nutrient dense, low carb diet first. And it's also quite important to get help when doing a keto diet, because if you do it badly, there's going to be a lot of nutrients that you're going to start missing out on. If you start getting rid of fruits and vegetables with colours in them so that you're just having green leafy vegetables and meat and fat, you're going to be missing out on a lot of phytonutrients. So it has to be done with care. And one of the best sort of new ways of thinking about this that I've seen recently is that it's this thought of keto flex diet. So you do a low carb, say modified Mediterranean style diet or a paleo style diet, a couple 2 to 3 days a week, and then you do ketosis the rest of the week. So you're going in and out of fat burning and carb burning, and that gives you metabolic flexibility and means that you can kind of enjoy social events, weekends and stuff. So they're all ways of eating that we would encourage in the right setting. But I think it's really important to remember there's not a right diet for everybody, and that everyone's different. And if patients choose to be vegan or vegetarian, then we will respect their wishes and try and tailor plans to them as well.
Yeah, you're absolutely right. Not one size fits all. We're all unique, and we all work in different ways. We all got kind of maybe different issues that we've got to work through, and one thing that works for one is the other. And then we've got the placebo effect as well, which is a miracle in some ways, isn't it? The effects that can have just for you. What I've found is if you're working with someone, and you believe in them and you believe in what they're saying, then straight away that just lifts you up, and if you start to believe that it's going to work, it's amazing what the mind can do. What's your thoughts on the placebo?
So, placebo effect, we know widely, especially when you look at research into medication for depression. The placebo effect is responsible for most of the response to antidepressant drugs. It's really hard to make a drug that works better than placebo. But that isn't something to be dismissed as something that's a fake. It's actually celebrating the body's own ability to heal. So like you say, having hope and having a way forward and feeling positive about the future are ways to persuade your body to start healing itself. You have to feel that joy and that energy, especially if these patients who've been hopeless and in pain for long periods of time, or fatigued for so long, or told that there's nothing else that can be done for them, and everything's been tried. For them, hearing the message that there is hope, yes, I think it really does help the placebo effect, but the placebo being the body starting to heal itself. Yeah.
Yeah, wow, it's nice to hear that response. So in terms of like some other people out in your field that you may be getting sort of that are inspiring you right now, is there any ones that I know you've talked on? Is it Dr. Brennan?
So Dr. Dale Bredesen, who has written the book, it's called The End of Alzheimer's. If you know anybody who's affected by Alzheimer's, or if you have a family member, I would really recommend getting his book and reading it. Sort of 2 chapters in, I was on the plane reading it, and I just had tears rolling down my face, just reading people's stories about being diagnosed with Alzheimer's and desperately going on a search. People basically pinned him down and said, "You're the expert in Alzheimer's, how do I get better?" Because he's not a clinician by trade, and so he started helping people with just amazing results, as you can read in his book. And it's a really tough one, taking on Alzheimer's patients, because of course and no one believes that there is anything that you can do for them. But listening to his work and the hope in his work has just been massively inspiring. And it's these things kind of, you get these amazing coincidences, don't you? As soon as I start reading his books and going to his conference, immediately I had 2 patients booking with, Alzheimer's disease in the next couple of weeks. So I'm working with them on his protocol. So yeah, these things just get sent to you at the right time. Dr. Sarah Myhill, she's a hero of mine. Sarah is a massive pioneer in the field of chronic fatigue. She's basically been doing it now for, 20 to 30 years, no, not that long probably, maybe 15 to 20. And she's got a massive following, very loyal patients. Unfortunately, she doesn't take on new patients anymore, but she's been a mentor to me and has been kind of a real help, especially with patients that I'm really struggling with. She's someone I can talk to and can kind of give me advice from her years and years of experience working with really sick chronic fatigue patients. So she's been amazing to learn from. Other people that are inspiring me at the moment, I think. We talk about the founders of functional medicine, really. All these guys in America who, in the last 30, 40 years, have been out there at the cutting edge, getting a lot of criticism from everybody else for doing stuff that isn't normal and is outside the guidelines to try and help people. There's just that. Mark Hyman, Jeffrey Bland. I've had a consultation once to try and help me out with Dr. Tom Salt, who's part of the IFM faculty, who's now stopped seeing patients to do research. There's just, these guys are just really, really inspirational, and also extremely brave. I think this field of medicine, stepping outside the box and stepping outside the norm, and having convictions to do something different, it is quite difficult. As doctors, we are trained to kind of follow rules and meet certain guidelines. And then when the guidelines run out and there's no way of helping somebody, there's a real temptation to say, "I'm sorry, I can't help you anymore." But that shouldn't be the case. There's always more that can be done. But the problem is that we're not trained in how to do it. And that's how I fell out of normal medicine and into functional medicine, is because I was the person that always wanted to do more. I can't live not being able to help people, and it's maybe my drive to kind of be a better doctor and to kind of know more and understand more and not be beaten by these conditions that has driven me to kind of start a whole new line of work and learn functional medicine.
Beautiful. You touched on Dr. Sarah Myhill and being a hero of yours. And I've just got into, off the back of you telling me about when I've been watching all the videos, and she's a real force for good, and she will not bow down to pressure or to the medical industry. She will go up, head to head with them, and she's been struck off, hasn't she? Didn't she?
I think she's just she's been taken before the GMC, I think 12 times, maybe something like that, basically just for helping people, and I don't think there's nothing that she's done wrong, and she's not been struck off, but she's been suspended for periods of time while she was investigated, but frankly I think that there were just a couple of people that decided they didn't like her, and it was a bit of a witch hunt, but thankfully she's still able to practice, but she's been through a lot in the name of helping people with chronic fatigue, and you have to have massive respect for somebody that is that brave. Yeah. So Sarah is properly brave, and nothing's going to stop her doing what she believes is right to help people. She is an inspiration. I'm hoping that I don't have such a rough ride as she's had, but I do know that colleague opinion of my work can be very varied. And for that reason, I will write to GPs about what they need to know about, or if patients don't want me to write to them. I have patients that are actually afraid of sharing with their GP or secondary care doctor that they're doing work with me on diet and nutrition, which is absolutely ridiculous. But patients don't want their doctor to feel that we are challenging their opinion, and therefore sometimes request that we don't inform them of what we're doing. So, yeah, it can be interesting at times.
Yeah, I bet. So one thing I wanted to ask you about, which is a little bit of a hot topic, is around vaccines, and particularly in children and whatever growing up, and I'd like to hear your thoughts on them.
So I think the first thing to say is that I have vaccinated my children, although I have felt extremely bad about it, because I have definitely come across children whose health has got worse after vaccination. So number one, I don't believe that parents who see marked difference after vaccination are making it up. I think that phenomenon definitely exists. Exactly why it happens, whether it's to do with immune activation, so we know that you can get increased autoimmune disease after vaccination, and in fact I actually wonder whether that's what drove my own Guillain-Barré syndrome when I was at med school, was that we know that the hepatitis vaccines you need to have to go to med school have got increased risk of autoimmunity attached to them, and so developing Guillain-Barré, I always wonder whether it was vaccine related or not. I don't know. So autoimmunity can be an issue, and we know Guillain-Barré is particularly, which is what I had, can be related to the flu vaccine. So that's why I don't have it, even though I'm working as a doctor, because it was contraindicated, and now I think the risks of becoming paralysed again are too great for me to warrant having the vaccine. The other problem is that while 99.9% of the population are going to be absolutely fine with vaccines, yes, there may be a small percentage that aren't going to be okay. And the problem is that we have a big public health problem here. If on the one hand we don't vaccinate children, we will return to a time when children start dying of common viral diseases. It will happen, and to a certain extent, perhaps it has happened in some cases already. And the problem is that for us as a society is that we have chosen, or the powers that be have chosen, to sacrifice the health of a very small number for the greater good. And I think that that's being done without necessarily our informed consent. But the problem is, which parent is going to give informed consent for their child to be vaccinated, even if they think there's a tiny, tiny, tiny risk that damage could come to them? And then the problem is, if more and more parents don't vaccinate, then there's a risk to children who are very ill, who can't have the vaccines, and who then may pick up the infection. I think there might be ways of making the vaccine schedule safer. And I think that we are very fortunate in the UK that if you think that your child is going to run a risk from having vaccines, or perhaps they've had problems with one set and you don't want them to have more, you have the choice of not having them vaccinated. Whereas in the States, that looks like a choice which is being taken away from parents, even of those who have chromosomal disorders, metabolic problems, or who were perhaps preterm, who we know are much more likely to have adverse consequences from vaccines. It's an extremely controversial topic, and I would certainly not encourage parents not to vaccinate, but I would encourage them to think about ways to protect their children nutritionally around vaccination times. And if there is a family history that might be linked to increased harms from vaccines, then sometimes spreading out the schedule can reduce the burden of heavy metal adjuvants which are given with the vaccines. So what lots of patients don't know, or parents don't realise, is that when we give a vaccine, we use an adjuvant to stimulate the immune system, and that used to be a mercury, thimerosal, but is now aluminium, predominantly in childhood vaccines. And unfortunately, if you have a detox system and you're one of these rare people who doesn't deal well with heavy metals, then you're more likely to accumulate those tiny doses of heavy metal in your system over time. The problem is we don't know who the people are who have got problems metabolizing heavy metals. We don't have the ability to do big genomic screens on them all prior to vaccinations, and therefore it's deemed safest to give vaccines. The problem is that there's no forum for debate on this issue, because almost there can't be, because you can't give the public a choice in this matter, because too many of them might choose not to, and then our entire public health strategy around protecting children from viral illness will fall apart. There are pros and cons in both directions, and far be it from me to say I know the answer to this one.
Yeah, complicated matter. It's not black or white.
Very complicated, and something that as a clinician really it's very difficult to speak about, because you could be told that you're an anti-vaxxer. I'm not an anti-vaxxer. I recognise that there are problems that we have with vaccines, and I wish that they would do more research and do more to make vaccines safer for the patients who cannot tolerate the heavy metals.
How can you find out? Can you find out in advance that a patient isn't going to tolerate heavy metals before you would give them the vaccine?
Well, I mean, if they've had problems with one previously, you're going to think about it. If there's a family history of autism spectrum disorder, maybe. I don't think that vaccines cause autistic spectrum disorder. I think that has been shown not to be the case. What I do think is that some autistic children have multiple chemical sensitivity or have lots of problems processing chemicals and metals, so that when they're exposed to the vaccine, it exposes their underlying genetic problem or metabolic weakness. And then of course you live with the consequences of having done that. But the likelihood is that some of those symptoms would have manifested anyway. It's just they will manifest given the right trigger at the right time, perhaps. For myself, I know that I have problems with certain metabolic detox pathways, but that wouldn't stop me having a vaccine that I really needed to travel. So my family likes to go to Germany, where there is a lot of tick-borne encephalitis, which there is no cure for. It's viral, and if you get it, you can die. and we go climbing in the forests where there's a lot of ticks. I've been vaccinated against TBE. Yeah. So I think a measured response in all things, and parents who decide definitely not to vaccinate their children, they're not doing it because they're mad, they're doing it because they've read information that shows that there could be harms. And so to an extent those parents' wishes do need to be honoured, but at the same time I think this is just a discussion which needs to be had on a public policy basis. It's very difficult to say about one specific individual.
Yeah, I was just going to say that then. I think it's just good to have the conversation, and rather it just be complete polar, like you say, one's anti-vaxxers and it's the other way. It's not, there's somewhere, you know, in the middle, and I think like anything, it's good to talk about it. So I appreciate you answering the question.
Thank you.
Thanks. You know, for you personally, what do you do to switch off? You know, you've obviously it's more than just a job. It's very much like, it can feel like it's probably you're all in on it, because, you know, you can get excited about new things and research and new possible things. So I'd imagine it, for me, in my own experience of stuff, it can be tricky to switch off because you have a hunger. Well, I'm thirsty for knowledge and wanting to seek stuff, but I'm interested in what can you do. You mentioned then about going to Germany climbing. Well, them kind of things will tie into you, you know, switching off.
Yeah, so I mean, the first thing to say is that I've got 2 little boys, so really I try and keep at least 1 day a week when I don't work. That sounds awful, but you know, I'd like 2 days a week and preferably 3, and I'm hopefully working towards a better work-life balance. So spending time with my children, and typically at the weekend, if the weather's nice, we'll go outside to the Peak District and do some climbing, do some walking, maybe see family. If the weather's horrible, we go indoors climbing. My oldest one's now doing a bit with us. So yeah, climbing is kind of my hobby of choice. And my husband is a really good climber, which is why we don't have holidays, we have climbing trips. So it's really nice though, because we get to travel the world and see different climbing areas, so different parts of the country that perhaps most travellers wouldn't see. I like playing the piano, and I really like to have more time to sort of get back into my gardening and things. At the moment, because I've been building my business and working 2 jobs with 2 small children, I don't have a lot of time for downtime at the moment. I've got so many books that I've got stacked up at the side of my bed that I want to read, but don't have time to at the moment. And so I'm hoping things are going to settle down in the next couple of years, and that maybe I'll get better work-life balance, maybe get to do a bit more exercise, trying to get into yoga at the moment. So relaxing for me isn't really a problem. I'll get tired and I'll happily relax and zone out and chat to my husband or play word games, things like that. But it's actually about doing a little bit more outside of my job at the moment. I'd like to do a bit more travel, do a bit more exercise.
So have you been over to, is it your husband got anywhere near El Capitan over in California?
No, so I mean, we've only had one American climbing trip when my youngest was 1.5. Well, my oldest, was 1.5. We only had one child at that time, and we went bouldering, so no big walling, no El Cap. So bouldering is where you just take big crash pads and you climb, maybe 20 foot off the floor kind of thing. So we've been climbing in America, but only bouldering, not done any big wall stuff. We mainly do sport climbing in Europe, so that's where the walls are already bolted and you kind of climb up with a rope and clip in as you go along. So we like climbing in the Frankenjura in southern Germany, lots of places in France, go bouldering in the forest in Fontainebleau, just south of Paris. been to Thailand. I've done lots of travelling, climbing.
That sounds amazing. I haven't actually done. I've done a little bit outside with a friend, and then I go to the bouldering centre over in Liverpool, and there's such a nice vibe about the place. It's just lovely. Everyone who works there, whatever, it's just so supportive, and you just have some really nice chats, and everyone's sort of behind you and willing you on to make that leap or that next bit up. And yeah, I haven't done enough of it recently, but it's something that for me, I think me chatting to you and hearing that, and I've seen some of your husband's photos on his Instagram are phenomenal, they're inspiring me to get back and climb up the wall.
So yeah, learning indoors is great, and it's a really nice sort of indoor sport. It's a nice sort of camaraderie, isn't there, in the walls, but climbing outside is really something special, and something that hopefully as the boys get a bit bigger that we'll be able to do more as a family. Obviously the little one's too small yet to join in and tends to get bored when we go outside. So yeah, I'm looking forward to that in the future.
Great stuff. So one of my last questions, which I ask to all my guests, so this podcast is all about sharing what good people are doing, like your good self. What advice would you give to someone who's looking to go out there and do their own bit of good in the world?
If you found the thing that you're passionate about and that you really want to do, there will be a way to do it. I've always wanted to help people. That's kind of why I went to medical school, but it wasn't until I was sort of in my mid-20s that it sort of crystallised that I wanted to do something a bit different and a bit out of the ordinary with my medical career. And just circumstances have conspired to allow me to do it. It's been amazing. But I think that's because I've always had in the back of my head that it's something I wanted to do. It kind of that drives you. Whatever it is that you want to do, you can make amazing changes to people's lives. You should go for it. It's not only helps others, but also can be life-changing for yourself as well.
That's amazing. And yeah, you are the living example of someone who's doing good and is helping others but helping yourself. So I would love for people who would be listening to this to also feel inspired to go out and do their own bit of good. So thank you very much. And then how can people best connect with you then if they're thinking, you know what, Sarah's close to me, I would love to come and see her. What's the best way for people to connect?
So you can go on our website, which is at www.drsarahdavies.co.uk, or you can Google us, and we've got a contact number, which I can't remember at the moment. And we're shortly going to start having a bit more of a media profile on Facebook, so watch this space.
Great stuff. Well, I've really enjoyed chatting to you. I really appreciate your time today, so thank you very much.
Thank you, it's been great.
So there we have it. There's another episode all wrapped up. I hope you enjoyed it. It was, full of detail, full of wisdom, full of knowledge from my point of view. And I think, if anyone is out there who's, is struggling with any kind of health issues and want to be able to get to the root cause of them, then maybe working with a functional medicine practitioner. And if you're in the Northwest, then I think Dr. Sarah is potentially a great resource for you to lean on in that way. I'll include a link to Sarah's website and to some of the things that we've spoken about today, so you guys can go off and do some of your own kind of digging and researching and all that. So anyway, guys, until next time, have a good one.